Good afternoon, everybody. This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facet staff, I'd like to thank you for joining us today. Today's webinar is entitled Health Plans and How They Interface with the IEPs. Our presenter today is Louise Wilson. Louise is a licensed school nurse and nationally certified as a school nurse. She has been involved in school nursing at the local, state, and national level for over 28 years. She provides expert leadership, consultation, and technical assistance to school nurses, state and local agencies, professional organizations, and parents and families regarding school nursing and health services. It gives me great pleasure today to introduce to you Louise Wilson. Louise?
All right, thank you. Well, I'm glad to be here and welcome all of you who are participating in person, listening to this live, and those of you that might view the recording later. So as Bonnie said, I'm the state school nurse and health services consultant for the Wisconsin Department of Public Instruction, or DPI. As such, I provide statewide leadership in the areas of school health, students' physical and mental health, school nursing, and student health services in general. I'm responsible for state-level policy development, resource development, and informing legislation in the areas of school nursing practice, health promotion, and wellness. In addition, I provide consultation and technical assistance to school personnel, community providers, and family members regarding the provision of health in schools. I collaborate and serve as a health liaison within the Department of Public Instruction and with other state agencies, state and national committees, community-based organizations, and Wisconsin schools and communities in promoting health and wellness, reducing health disparities, and preventing chronic disease in children and staff. I have a passion for school nursing, believing school nurses are strong advocates in protecting and promoting the health of school children. In addition to the 29 years of school nursing experience in Wisconsin, I have national school nursing experience, having served on the board of directors and executive committee for the National Association of School Nurses, and I'm presently the president-elect for the National Association of State School Nurse Consultants. There's a lot of confusion on how health plans interface with IEPs. Frankly, there's a lot of confusion about how health plans are used in schools. My goal today is to explain how health plans are used to identify the health-related needs of students, how school nurses and school staff use this information to address the severity and nature of the health condition or disability, and how the health condition affects the student's involvement and educational progress. Specifically, this is what I will address. I'm going to identify the various health plans used in schools, describe how a health-related need translates into an effective disability or disability-related need in special education evaluations, or the IEP. We're going to locate in an IEP how a school plans to address a student's health needs. And then hopefully we'll be articulating how decisions regarding who meets health needs in school might be determined. It's always good to start at the beginning. So first, I'm going to describe the various types of health plans used in schools and hopefully remove some misconceptions of the term IHP. There are 3 different types of health plans used in schools. They are listed on this slide. So we're talking about the Individualized Healthcare Plan, or IHP, the Emergency Action Plan, or EAP, and then the Student Health Plan. As I will describe, an IHP is not what most people think it is. So we're going to start with the IHP, or the Individualized Healthcare Plan. A variety of documents are used in the educational setting to support student health, safety, and success. Confusion often exists in the education and healthcare fields regarding the purpose, components, and contents of the IHP. Many outside the profession of school nursing have attempted to define and describe the use of IHPs. Educators, families, non-school healthcare professionals, and even school nurses have used the term IHP to describe a multitude of health-related plans. In the school setting, the IHP is a counterpart of the nursing care plan used in hospitals by nurses. The IHP fosters communication among nursing staff to promote continuity of care, for example, when a substitute nurse is required, or as the student progresses through the school system. An IHP is a written document that outlines how children will receive healthcare services at school and is developed and used by a registered nurse. The IHP documents a specific student's health needs and outlines specific health outcome expectations and plans for achieving these expectations. As professionals, school nurses determine what documents they use, how they use them, and what they are called. The school nursing profession has claimed the term individualized healthcare plan as a nursing care plan school nurses develop to document their thought process, nursing assessments, and what they as a nurse plan to do to meet the needs of the student. In a few slides, I will show you what an individualized healthcare plan really is. You will note that there are 4 sections. These sections relate to what nurses, and really any nurse, calls the nursing process. A very important part of the nursing process is to evaluate the care given to see if it had an effect. The IHP helps registered nurses manage the risk of certain health conditions and coordinate care with other staff, such as food service staff and teachers, and health service providers outside of the school. Federal law does not require the use of an IHP, but its contents can be useful to the nurse in addressing the requirements of federal laws related to school responsibilities for children with healthcare conditions. IHPs provide information for the delegation and determining of staffing needs in each school. IHPs may or may not be part of the IEP process or 504 plans, and IHPs are designed to be standalone documents. This is what the school nursing profession has determined is an IHP. It contains areas for the nurse to document all the steps in the nursing process. If a school nurse has written an IHP, all the information will be there to document the health-related needs of the student for the special education evaluation and IEP. As a parent, you may never see this nursing care plan or IHP. School nurses are not required to get parent or healthcare provider permission for this document, which is essentially a professional work plan for the school nurse. Due to capacity issues, many school nurses do not have well-defined or written work plans for students, as they spend more time writing the other health plans that staff will see and use. School nurses use the information from an IHP or from what they obtain from the parent or other school health records to write emergency action plans, or EAPs. These EAPs are written for students with severe or life-threatening health conditions. Emergency action plans, or EAPs, are written for school staff to follow in severe or life-threatening situations. Students at risk for seizures, anaphylaxis, low blood sugar levels, adrenal crisis, hemophilia, etc. might have an EAP. They are often written in a see this, do that manner. They are step-by-step instructions for school staff without medical license or much training to follow. EAPs are shared with school staff who might be anticipated to respond or implement the plan for a particular student. Here are some sample templates school nurses might use. Because these are first aid measures, those schools without a school nurse might also use templates to share emergency action steps. This is an example of an EAP that can be downloaded and used by schools. It's from the Food Allergy Research Education Organization, or FARE. A third type of health document used in schools is a student health plan. There are probably a lot of names schools use for these plans. My district used to call them medical alerts. Student health plans are more than an emergency action plan, but it is still written for school staff. Most people, I think, are thinking of this type of document or health plan when they incorrectly call it an IHP. IHP is the term the school nurse profession uses to describe their nursing care plans that document the nursing process. Others need to learn to not misuse the term. So I will be using the term Student Health Plan, or SHP, and not IHP from now on, unless I'm specifically talking about the nursing care plan. So to review, IHP addresses actual or potential responses of a student to a health condition, and it's the nursing care plan for school nurses. Emergency action plans and student health plans are used to communicate student health needs to school staff. And an EAP deals with a specific potential or medical emergency. Here's a general overview of the different health plans and their use. Now that we have identified the various health plans, we will discuss how they fit into the special education process, and specifically an individualized education program, or IEP. By the way, special educators have a similar problem with people not knowing what IEP stands for. Many incorrectly equate P for the word plan and not for program. If a student has a health plan, be it a student health plan or an emergency action plan, it is an indication that a health need exists. So the statements of that health need and the actions required will be used in the special education process. But note, as the slide indicates, the actual plan is not part of the IEP document itself. The reason as stated on the slide is that if the health plan needs to be changed, an entire IEP meeting must be held or special forms created and signed. Not every student who has a health need is evaluated for special education services. But since the audience for today are those parents and staff interested in special education, we will proceed with the assumption that a special education evaluation is taking place. Next, I will describe how a health-related need translates into an effective disability or disability-related need in special education evaluations and the IEP itself. The term adversely affecting educational performance is central to understanding special education. In order to identify a student as meeting education eligibility for an impairment, the IEP team must find the student's learning and educational performance is adversely affected. Some health needs are such that it will help the student qualify for special education services. The health need is such that it adversely affects the student's learning or educational performance. Other health needs simply need to be addressed or mentioned in the IEP because of safety needs or nutritional needs, but the need in and of itself does not impact the student's learning or educational performance. Later, I will give you an example of both situations and what might be documented. Another key concept is defining what is a child with a disability. As parents of students with IEPs, you are probably familiar with this concept. You most likely were told that two prongs or two needs had to be met before your child would receive special education services. A child must have a disability that adversely affects their education, and as a result, they need special education services. You can have a child who has a disability and it adversely affects their education, but this student then would need to be determined to need special education services before they receive such services in an individualized education program. For example, not every student with diabetes type 1 requires special education services and therefore would have an IEP. But every student with diabetes should have health plans, including an emergency action plan, a student health plan, and ideally a nursing care plan or IHP. Many students with diabetes, particularly if the diabetes is not well controlled, might actually be found to have a disability that adversely affects their education because they miss school for medical appointments, miss a lot of class time due to low blood sugar levels and needing treatment, not being able to concentrate when they have frequent high or low blood sugar levels, or other issues. But not all of those students meet the second prong that they require special education services. When I participated in special education evaluations, I explained to parents the concept that requires special education services means that the student needs educational services that only a specialized teacher can implement. Not even a really good teacher can provide what the students needs. Now, this may be an oversimplification of special education, but it did help parents understand why their child with a health need, who they thought was struggling, did not qualify for special education services or an IEP. Next, I will discuss how school personnel on an evaluation team determine there is a health-related need. Listed on this slide are 3 areas to address and the 3 parts of the special education paperwork where the information will be documented. These are important concepts, so I will read them. The impairment categories may include students with many different medical diagnoses. Medical diagnosis is not required to determine educational eligibility. If the medical information is available, it should be considered, but it must not be the sole component. And school nurses are often serve as an important role in explaining how the impairment categories and medical diagnoses relate to each other. Not only are there many different medical diagnoses that might affect a child such that their education is adversely affected, but there are several disability categories under which a student might qualify. I'm going to talk about OHI, or other health impaired category, as this is the most common category used when the primary concern is health related. I stated previously, just because a student has a medical diagnosis does not mean they will automatically qualify for or receive special education services under an IEP. If your district has a school nurse, I strongly encourage you to specifically request that they serve on your child's evaluation or IEP team, as they will be the person most qualified to determine and explain the effects both educationally and otherwise of the health condition and how it impacts the student's school day. This is a summary of a student who might qualify for special education services because of his cognitive delays and lack of ability to communicate effectively. Both adversely affect his educational performance and requires him to receive specially designed instruction. These delays and communication difficulties are a result of one health condition, cerebral palsy. But he also has health issues that need to be evaluated to determine how they affect his educational performance and at the very least need to be addressed for safety issues. A statement such as what is written on this slide would be documented on the evaluation form for special education under functional performance. There may be several statements from the various other members of the evaluation team under this functional performance section to describe his educational needs. As the purpose today is to explain how health needs are documented, possible wording could be: Alejandro is a 5-year-old with cerebral palsy that affects his self-care and cognitive abilities and his communication. He is fed orally since his G button was removed 3 years ago and tolerates a soft mash diet. Alejandro requires assistance with oral feedings and daily cares. Alejandro has a known food allergy to tree nuts, cashews, pistachios, almonds, Brazil nuts, chestnuts, macadamia nuts, pecans, pine nuts, shea nuts, and walnuts, with a history of anaphylaxis. For a student like Alejandro, at the special education evaluation, there may be several disability categories which the teachers and others will discuss. As a school nurse consultant, I am most qualified to discuss the OHI criteria used in special education evaluations. So that is the disability category I'm going to use to demonstrate how health needs are evaluated and documented in a special education evaluation. All the boxes on the form must be checked yes in order to qualify as having an OHI disability. The first prong of a disability is that it adversely affects the student's education. Other health impairment means having limited strength, vitality, or alertness due to chronic or acute health problems. The term includes but is not limited to a heart condition, tuberculosis, rheumatic fever, nephritis, asthma, sickle cell anemia, hemophilia, epilepsy, lead poisoning, leukemia, diabetes, or acquired injuries to the brain caused by internal occurrences or degenerative conditions, which adversely affects a student's educational performance. Remember, a medical diagnosis is not required, nor does having a medical diagnosis automatically qualify a student for special education services. So in answering the question, does the student have a health problem, the school nurse might write, Alejandro is diagnosed with cerebral palsy, a condition most likely caused by his traumatic birth history. His cerebral palsy affects his self-care and cognitive abilities and his communication. Alejandro has a known food allergy to tree nuts, cashews, pistachios, almonds, Brazil nuts, chestnuts, macadamia nuts, pecans, pine nuts, shea nuts, and walnuts, with a history of anaphylaxis. Alejandro has emergency epinephrine ordered for any signs or symptoms of anaphylaxis or if tree nuts are inadvertently ingested. The next step in an OHI determination is to document if the health condition is chronic, which means long-standing, or acute, which means severe or intense. One or the other or both need to be checked. So under chronic, might document something such as Alejandro was diagnosed with cerebral palsy during his first year of life after failure to meet developmental milestones, and other neuromuscular conditions were noted by his family and healthcare professionals. And under acute, Alejandro experienced an allergic reaction later diagnosed as a tree nut allergy. He experienced a life-threatening reaction requiring emergency treatment and hospitalization. Then the team discusses how the student's health condition affects their strength, vitality, or alertness. Here, 1, 2, or all 3 can be impacted. I suggest at least 2 of these areas are affected. So under strength, Alejandro experiences spastic movements of both his arms and legs. This causes difficulty in grasping objects or using them as intended. For example, he is unable to direct a spoon to his mouth without help while eating. He is able to ambulate, but safety is a concern, particularly as he enters kindergarten in a more crowded classroom with large numbers of other students. And under vitality, Alejandro requires rest breaks as his muscles tire, particularly when he is standing or ambulating. This section 2 is where the team documents how the health condition affects the student's educational performance. Again, they may have an acute or chronic health condition that affects strength, vitality, or alertness, but to receive special education services, the health condition must adversely affect the student's education. There are several areas, not all need to be affected. Note which ones are checked on this slide and listen to the possible summary. The special education teacher or other team members may document regarding academic achievement or also add information to any of these areas. So Alejandro requires additional assistance with activities of daily living, not required of other kindergarten students, such as feeding, toileting, safety monitoring. Alejandro's verbal communication is often unintelligible to those unfamiliar with his communications. Alejandro is at risk for injury if he is exposed to his food allergens. Alejandro has cognitive disability that affects his ability to self-advocate, protect himself from exposure to his allergens, or alert staff to symptoms of food allergy. Alejandro experiences spastic movements of both his arms and legs. This causes difficulty in grasping objects or holding them as intended. He requires adaptations for holding objects such as crayons or markers and needs assistance to direct his arm and hand movements. Section 3 is on the revised special education forms, and these forms were updated in May of this year. Checking this box means the student has met the criteria for other health impairment, the first prong. So now it needs to be determined if the student needs special education services, the second prong. So once you have the disability category, you've met the first prong, now we need to meet the second prong. After determining the student meets the criteria for OHI, then the team uses that information to determine the functional disability related need. This is one more area parents will note health information is documented. This information is what may lead the team to determine the student under evaluation requires special education services. For Alejandro, his cerebral palsy is a health condition that impacts or adversely affects his education. Others besides the school nurse would document how this health condition impacts his communication, motor skills, classroom performance, social and emotional functioning. In Alejandro's case, he may not require special education services because of his food allergy, but because he has a safety need, his health needs do need to be taken into consideration. Note how the EAP is mentioned. In Alejandro's case, one of the things his teacher might work on is helping him communicate that he is having an allergic reaction. So Alejandro experiences spastic movements of both his arms and legs related to his cerebral palsy. He requires assistance with self-cares and feeding. Alejandro requires an emergency action plan to prevent and treat any exposure to tree nuts. Alejandro is at risk for injury if he is exposed to his food allergens. Alejandro has a cognitive disability that affects his ability to self-advocate, protect himself from exposure to his allergens, or alert staff to symptoms of food allergy. Alejandro is not able to participate in his education if he is ill or injured after exposure to food allergens. And the student needs to develop or improve ability to communicate symptoms of allergic reactions. I'll share another example of a health condition that impacts the student's education and how this might be documented by the school. This example is for a student who has seizures. I'll share sample documentation under the functional performance and disability related need. Here's how the functional performance statement might be documented. Note how the health condition seizures is linked to the problems the student is having with learning. This student also has an EAP, but it is for the health condition that is being evaluated as qualifying him as having a disability. Alejandro had an EAP for food allergies, but the food allergies did not qualify him as having a disability for special education services. Alejandro's cerebral palsy is a condition that affected his education, but there were no emergency steps that needed to be taken to keep him safe due to his cerebral palsy. Here the team is trying to determine if Chris's seizures affect his education and his seizures are life-threatening, so he has an EAP for school staff to follow. So again, documentation might be, Chris was diagnosed with generalized tonic-clonic convulsive seizures in 3rd grade. These types of seizures have occurred during the night while Chris is sleeping or falling asleep. In 5th grade, he was also diagnosed with absence seizures. Chris is on medication for both types of seizures and takes 1 dose of medication at school at 1:00 p.m. Chris has consistently come to the office for his medication with few prompts. Chris continues to experience 1 to 3 generalized tonic-clonic seizures most nights of the week. These seizures interrupt his sleep pattern, causing daytime fatigue and drowsiness. His neurologist reports these nightly seizures activity also affects his ability to store and process information learned during the previous day. Chris arrives late to school 1 to 3 days per week due to fatigue and morning fog. Chris passed both his hearing and vision screening at the end of 5th grade. Chris has an emergency action plan in place, and school staff are trained to give medication in the event Chris has any tonic-clonic seizure activity at school. It is unknown if Chris is continuing to have absence seizures at school. Like Alejandro, Chris's special education evaluation team would go through the OHI criteria sheets. I am not going to demonstrate sample statements for Chris as I did for Alejandro. The team would determine if Chris meets the criteria for OHI, if his education is adversely affected, and if he requires special education services. The purpose for this section of the evaluation form is to document how the health condition affects the student and why the student would need special education services. So again, documentation would be to that effect. Chris's frequent nighttime seizures cause fatigue. Chris is unable to attend school on time 1 to 2 days per week and has missed a significant amount of math and reading. While at school, Chris is unfocused, and he states he is often confused about what is happening in the classroom. It is possible Chris is experiencing absence seizures while at school. His family and medical professionals are working to diagnose and treat. While having an absence seizure, Chris misses the instruction that has occurred and needs the material repeated. His sleep deprivation affects his memory and ability to process information. Chris is concerned how his having seizures is being perceived by his classmates. The student needs to develop and improve targeted instruction in math and reading. Information presented in a manner he can process. Okay. Once a student has determined to have a disability, the disability adversely affects their education, and they require special education or related services in order to benefit from their education, the team develops the Individualized Education Program, P for program, not plan. So next I'm going to point out where in the IEP parents can find documentation of the measures the school will use to address the health needs of the student. How the health needs will be addressed is documented in these sections of an IEP. So they'll be documented in the program summary and supplement aids and services. They'll be documented in the related services needed to benefit from special education section and in the program modification or supports for school personnel section. DPI has sample IEP forms, and the IEP is called an I-form. This is one section of the I-4. Districts are not required to use our DPI forms, but many will or adapt them slightly. Under this section, called Statement of Supplementary Aids and Services, would be where you would find the accommodations the team determined would help your child. Note some examples of the accommodations on the slide. The last line is what I tell school nurses they might document and how they would state it. You might find a similar statement for your child. The next section you would find documentation about your child's health would be under the related services needed to benefit from special education section. Here's the description of the difference between direct related services and indirect related services. Direct services are those that involve hands-on nursing interventions, medication administration, tube feedings, urinary catheterizations, glucose testing, and physical assessment are examples of such. Indirect services are those provided on behalf of the student, such as calling the parent to update the student health plan, communicating with medical provider to clarify orders, and delegating nursing procedures to UAPs or unlicensed assistive personnel. There are numerous related services, and they are all listed on this form. For brevity, I'm only going to describe the two services related to school nursing. This slide describes the difference between school nurse services and school health services. We'll come back to this in a few minutes, but school nurse services are services provided by a qualified school nurse. School health services are services that may be provided either by a qualified school nurse or other qualified person. This section, Program Modification or Supports for School Personnel, is the third area where you will find documentation of how a school plans to address your child's health needs. This section describes what health training will be provided to school staff so they are capable of meeting your child's health needs. Note how the health plans could be mentioned here in the IEP, but they are not attached. Sample wording might be something like, the school nurse will train staff on seizure recognition and management, including how to administer nasal diazepam. Or the school nurse will train school staff to perform a G-tube feeding and provide ongoing support and supervision. My final objective is to describe some of what goes into determining who meets the health needs of your child while at school, and if school nursing or school health services are required. These are sample statements that might be documented in an IEP to describe what service is needed and why the service is needed, what disability-related need the service addresses. So it might be documented, nursing and school health services are required to provide medication management and administration to maintain health status and attendance pattern in order to obtain IEP goals. Or school health services are required for medication administration so that can concentrate and control his impulsivity in order to obtain his IEP goals. Or the student requires tube feedings to maintain nutritional status while at school. This tube feeding will be performed by the classroom teacher assistants under the delegation of the school nurse. So that would mean that the child is receiving school nursing and school health services. Or the student requires school nurse to train staff on implementation of the emergency action plan to maintain the health status in order to obtain his IEP goals. So again, school nursing and school health services. Now, we maintain to school nurses and to parents and school staff that unless the staff is trained on this, and unless they can implement the emergency action plan, obviously if a student's having an allergic reaction, they can't participate in their education. So again, would be the reason for having the emergency action plan and for having school nursing or school health services. Again, here's the description of these services. So school nursing services provided by a qualified school nurse, and school health services either by a qualified school nurse or other qualified person. So what makes a person qualified? Well, that's a good question. Does the level of care require a nursing license? Can care be safely, therefore legally, delegated by a registered nurse to LPNs or less skilled assistants? These are the questions the members of the team will need to answer to determine if the related services are school nursing or school health services, and then who might provide this service. Part of the answer to what makes a person qualified is if it is legal for them to provide the service. Does it violate the Wisconsin Nurse Practice Act? Is the person sufficiently trained? As you can see, it would be very important to have the school nurse or a registered nurse be at the meeting to determine the answer to these questions. Under the related services section, it'll be documented what level of service is provided. Names of individuals are not documented. The amount of time, how often the service is provided, and what the service provided is documented. And here are some sample statements. So every day for 45 minutes in the special education classroom, it's for the whole IEP year, and because they're totally dependent for a tube feeding. Or again, once a week for 45 minutes, and it's going to be the school nurse services, and it's going to be because they're supervising the delegated procedure. So here's a summary of how health plans interface with IEPs. If a school nurse writes a nursing care plan, the information outlined in the IHP will be used to describe how a health need impacts a student's functional and academic success. Health plans are not included or attached to the IEP, but the information in them does help determine how the health condition impacts the student, what interventions are required, and who might provide that intervention. Having a health plan to follow may be part of the program modifications or support given to personnel so they understand what to do to keep the student safe, such as an emergency action plan, or meet other aspects of the student's health needs. A final reminder that the health plans themselves should not be attached but remain independent documents referenced in the IEP. So that kind of concludes my plan presentation. Here's my contact information. In the slides, I'm just going to kind of show you that there are some references so that you can look at those if you'd like to. And so there's some references again that you can look at with your handouts, and I'm going to return back to the contact information. And I guess, Bonnie, I'm ready if there are some questions. I'd be glad to answer.
Okay, well, we do have a couple of questions and some comments. One is a comment by another person from the DPI who just wanted to remind everybody that a medical evaluation is required for 3 disability areas: blind and visually impairment, deaf and hard of hearing, deaf, blind, and significant developmental delay. And if there were some questions, people could reach out to other consultants at the DPI for that information. So that's a little bit stepping in a different direction there. So that was a comment. And then a comment from another person now is stating, are you saying that none of any of these 3 plans should ever be attached to an IEP?
Yes, I am saying that because if you think about like an emergency action plan or any of the health plan, again, the IHP, the nursing work plan, really doesn't need to be shared with anybody. That again, if you're using IHP, and I'm using it in the term that it's supposed to be, is a work plan for a nurse so that he or she knows what to do and can share with another nurse. So again, not even a document that anybody else besides the nurse is going to see. So that's not attached. If you had an emergency action plan or a student health plan, it's going to list, maybe what times, a student receives medication or how much of a med they're going to get, or, that they're going to get this tube feeding and this is the formula. And if any of that information would have to change, if it's part of the IEP, technically you would have to have an IEP meeting to change that part of the document, just like you have to have an IEP meeting if you're going to change anything else in a document. So yeah, it's recommended that it's not be attached. It's not part of the IEP, but it certainly needs to be referenced and say that the school district has created, and again, generally the school nurse would create those health plans, and that staff are trained to follow those health plans. But they should not be stapled. They should not be part of it. And again, anytime you have health information in an IEP, that kind of raises the confidentiality level of that IHP or that IEP too. So again, a reason not to put in health information, not to put those health documents, I'm sorry.
Another one is related to that. And what would be your feelings on, like, for example, a sample page on health concerns that people should know? Number one, there is another student health plan that exists, and then maybe list some of the adaptations or accommodations that would be necessary for specific teachers to follow. What is your feeling on that?
In the nursing world, there are such documents. There's actually, a really good reference book that I always refer school nurses to kind of give them an idea of what kind of accommodations might be used. But I think that, DPI stance always is that everything needs to be individualized. I guess you could have a list of, 50 or 60 different accommodations that might help a student. But again, individual characteristics of that student would be so different that I don't think that you could list and say that every student with cerebral palsy would need these kind of accommodations, or every student with seizures would need to have those. Again, there are books that help school nurses figure out what kind of health needs and what kind of, again, this is a nursing term in the nursing process, nursing diagnoses a student who has seizures might have, but and there are those references for school nurses to use. Yeah.
Okay, and a follow-up to that was, would you offhand know the title of the book that you share with others in that area so someone might be able to use it?
Well, let's see. I'm on camera here, and I'm just going to go over and look here. Hang on just a second. Oh, So the book is Individualized Healthcare Plans for the School Nurse, and it's the second edition that's out there now.
Okay,
And
thank
again,
you.
yeah, if school nurses are out there and want to know, they can certainly contact me. And I know that you can purchase this through the National Association of School Nurses.
Okay, and going back to that other question on a sample, like one pager of accommodations, I think the person was meaning specifically student focused, that particular individual student, and maybe a listing of specific accommodations for that person because of his healthcare concerns. These are things that teachers either should be watching for or should be knowledgeable about.
Right. And so let's see if I can do this without making people too dizzy. But yeah, so this is where the school should document that. So there is this section called Statement of Supplementary Aids and Services, and that's where, and these are just some sample ones of just kind of like generic and with a lot of different kids with different health conditions. But this is exactly where your school district would be documenting what your child would need. So again, all the specific accommodations. So this is where it should be documented.
Okay, so let's say as an example, this person is saying that if you were a teacher in a grade school and you had a student in your class who had several different health issues and needs, how is that information shared with teachers from the nurse, and how are they accessible for in the IEP to a particular teacher?
Okay. Well, again, it might, vary school district to school district how they share that information, but generally, again, anytime that there's a health condition, and hopefully the school district has a school nurse. So one of the primary responsibilities of school nurses are to write those student health plans or emergency action plans, and those then should be they're written for the teachers and for the lay staff, so so that they know how to meet the healthcare needs and in emergency action plan keep the student alive potentially. So those would be shared with school staff. Again, it depends on the school district. Sometimes there is electronics systems where they're part of the electronic record, and the teachers who have access and need to know that information, can click on that button and see that student health information. Sometimes they're handed out specifically to each teacher. The school nurse might walk around and hand it out to each teacher. And again, if the regular ed teacher also has the student who also is receiving special education services, again, that emergency action plan, as I'm suggesting, is alluded to in the IEP, and so the regular ed teacher should be reading the IEP to understand what all are the educational needs of this student, and would see that there's an emergency action plan and would be asking for it. So again, schools, staff have need that information, and they have the ability to have that information. so that they can protect the health and safety of each student.
Okay,
I don't
thank
know.
you. We do have
Yeah.
one last question. And the question was, I believe you had stated that federal law does not necessarily include the statement that an IHP has to be written. So how did this come about?
Well, again, so an IHP as as I'm describing it is the nursing care plan. So IHPs came about because the nursing profession as a whole, and it doesn't matter if you work in a hospital, a clinic, or whatever, write nursing care plans. And again, if you're a hospital patient or something like that, you would never know that there's a document out there that all the nurses are looking at that have, taking care of you, on each of the shifts, and all of them are looking at and saying these are the health goals that we have for this patient, and here I worked on this part of the health goals, during my shift, and the next nurse is going to go. So we've always had healthcare plans, and so school nurses have just adapted that and say we're going to have a health plan, and we're going to call it an individualized healthcare plan. And for whatever reason, other people started using that term and misused it. So again, for a student health plan, again, there's a need, obviously, especially for emergency action plans, and then also needs because there's a lot of health issues that are happening to students that aren't necessarily life and death. An emergency action plan is really kind of a life-threatening health condition, and you got to see that. If you see this, you got to do this right away. But there's other health plans, and things like students with diabetes may have kind of both. They would have an emergency action plan. If you're seeing this hypoglycemic reaction, this is what you got to do. But then there's also the part of the health plan of they need to be coming down for their blood sugar checks. This is what's going on. You need to be realize that if their blood sugar is low, that they're probably not going to do well. They shouldn't be taking a test. So there's those kind of health plans. So I think they came about by just being a need for that information. But again, they're not addressed. An IHP or any health plan is not necessarily required in any federal statute at this point.
Okay, and
But it's
this I
best
promise is
practice.
the last question
No, that's good.
because it just popped up again. And it says, under the statement of supplementary aids and services, should we be listing that there is a student health plan or an EAP?
You could, but it's really not. That's not an accommodation. It's really not a supplementary. You could. I would tell school nurses that I think there's other parts of, and I shared them with you. There's other parts where I would write that, and particularly under that the aids and services support given to school personnel. That is a misunderstood section. I think years ago I used to see people would write all kinds of things, but it's really for the personnel. It's really not. It's student based, but it's really for the thing. So you would say that an emergency action plan is available for the student, for the staff, so they understand how to take care of the student. So that would be a better place, but you could, as you probably, you see my examples, you think like, oh my gosh, she's saying the same stuff over and over again. Yeah, some of the information is repeated several different times.
Okay, well, thank you very much. We really appreciate that. And thank you for taking the time to answer the questions that we have from those that are participating today. So Louise, do you have any closing comments that you would like to make before we end?
I guess again, I just appreciate the interest for those that are school health professionals to understand that, and certainly welcome and questions from school health professionals, but really to parents. My personal and professional heart goes out to you, as I know some of you have children who have very complicated and really dire health needs that you're sending them to school. And as a school nurse, I always felt that it was a great honor that you were trusting your child to the school district. And I always felt a personal responsibility that you were, as a nurse, that you were trusting them to me. So appreciate that. And, please ask questions if you're not getting the information, or there seems to be misunderstanding. Again, if it's a special education process, my special education colleagues are the best people to contact. But if it's kind of a health related need, feel free to contact me. And if I don't know the answers, I will certainly pass you on and make sure that you get the answers. But again, it is, we are seeing a lot more children with health conditions, both acute and chronic, and they certainly do affect the child's ability to participate in their education and to benefit from it and to be successful. So we want to make sure that we evaluate them and meet their individualized needs. And again, it's a very much individualized process. So so therefore, there aren't really always canned answers. So please reach out if you have questions.
Well, Louise, thank you so very much for all the information today. I know that I learned a lot, and I'm sure that those in participating today in the webinar did as well. So thanks again. This will conclude our webinar for today. We'd like to thank you all for joining us. Please be reminded that Wisconsin Facets will have over 80 scheduled trainings and webinars for the year 2023. We also have webinars from now until the end of the year. So please check our website calendar and register for any of those upcoming trainings that may be of interest to you. And also please watch for the short evaluation that will be coming your way after today's live presentation. Again, Louise, thank you so much, and thank you all for joining us today. Bye-bye, everybody. Have a good rest of your day.